And like Ms. Craven has said, my name is Debi Ussery. I am a registered nurse and currently going to Winston-Salem State University and obtaining my Bachelor in Science degree. Part of our final semester, we are doing a capstone project, and part of my capstone project is a teaching presentation, and Ms. Craven has been gracious enough to let me to come in to present my teaching project to the medical assisting group. When you graduate your class and you start working as a medical assistant, you'll probably be in a position where you're required to have to give some certain medications. And my goal is, I hope that you will obtain from this class the knowledge to not only recognize the signs and symptoms of an allergic reaction, but also to be able to properly administer a medication that could potentially be a life-saving medication for someone. First thing I'm going to do is I am going to pass around a sign-in sheet. If I can get everybody to sign in and just pass it along, and whoever gets it last, if they can just put it up on the table so I can put it back towards my packet. Also, I'd like to disclose I am not getting any kind of reimbursement for this Epipen training. This is just part of a school project that I need to present. There are different forms of adrenaline auto-injectors is what they're called. The most commonly used injector is called the Epipen, and that's where my focus is going to be presenting on, is the Epipen. In addition, I am going to pass out these little handouts. If you'll just keep them in front of you before opening them so I can demonstrate and discuss with you what we're going to go over. We try to incorporate different visual aids and handouts and tools to everybody has a different learning technique. So we try to incorporate the variety of different learning techniques to hope that you will grasp on one of them. And I hope everyone has a pen or a pencil, because when you get your sheet, what I want you to do is have this in front of you and just open the first section. There is a part called the self-evaluation. It is a test that it's not being graded. Ms. Craven is not grading it. I am not grading it. It's for your own evaluation of what you may already know about allergic reactions and usage of an Epipen. So I'm going to wait till everybody gets a copy. Get an idea of what your answers would be. The first one is, who can receive an Epipen? Your answers are choice of adult, child, teenager, or all of the above. It would be all of the above because it does not matter whether your age. Anyone who is having a severe allergic reaction can receive the Epipen. Question number 2 is, what medication is used in the Epipen? Your choices are Benadryl, antihistamine, epinephrine, or norepinephrine. And the correct answer would be the epinephrine, hence the term Epipen. Adrenaline is the actual name for the epinephrine. They correlate with each other. Benadryl, certain people can receive Benadryl when they're having somewhat of an allergic reaction, but the Epipen is used more for severe allergic reactions. And antihistamine, a Benadryl is a form of an antihistamine. Question 3 is, when should an Epipen be used? Your choices are during a sinus allergy, when your eyes hurt and you have a runny nose, during the flu season to prevent the flu, during the cold symptoms and you have a stuffy nose, or during food or drug allergies and you break out in hives, itching, and swelling of the throat. And your answer is D, because those are signs and symptoms of severe allergic reactions. How is an Epipen used? Your choices are expose the skin and clean with soap and water, expose the skin and wipe with an alcohol pad, expose the skin and circle an area with a pen so the needle goes into the circle, or inject medication regardless if the skin is exposed or clean. And surprisingly, the answer is D, because this is for an emergency use. It will go through blue jeans, it will go through whatever clothing you have, and it will inject automatically. You don't have to worry about cleaning the area or having it exposed. And with that, number 5 is, where is the Epipen administered? You have a choice of the outer thigh, the buttocks, the upper arm, or the stomach. And the correct answer would be your outer thigh. You have a large muscle that's in the thigh and that will be able to withstand the injection. And then, why is it important to keep an Epipen? Is it to prevent cold allergies, prevent the flu or to prevent sinus allergies or to prevent an anaphylactic reaction, and it would be D. That's just a little handout that has a lot of quick facts on there, just quick little reminders that you could have at hand without having to research further, and you have just something, a little handout to go with that. On our PowerPoint presentation, it says on here it's presented by Dawn Rains and Debi Ussery. We've put this project together as part of our capstone project. However, Dawn is teaching in her area because she lives in the north part of North Carolina, and I'm teaching here. What do you know? We've just went over that with the PowerPoint with the handout. We did the self-evaluation quiz, and we went over the answers. Allergens. What are allergens? There are substances that can cause your immune system to become overly sensitive, which may cause an allergic reaction. Allergens can be found in a variety of sources: eggs, nuts, milk, bee stings, seafood. There's so many different allergens that are out there that are a part of our world. Some of you may have already known somebody who has severe allergies and required to have an Epipen. And there are 4 ways allergens can enter into the body. The first one we have is skin contact. You can come in contact with poison oak, poison ivy, poison sumac, and it could be something as simple as deodorant, perfumes, lotions, powders. The list goes on and on. You can also get them from animals, pollen, and latex. There's a lot of people who are allergic to latex. Another form is injection, usually by bee sting or some kind of insect that can penetrate into your skin and leave their poisonous venom. Another way is ingestion. A lot of people take medications. You never know when you become allergic to a medication, because even if you've taken the medication before, you can become allergic to it eventually. Also, it covers nuts and shellfish. Anything you eat. A lot of people are allergic to strawberries, peanut butter, things of that nature. And finally, there's inhalation. You can inhale the pollen, and coming into this fall season, mold spores are very high, and you'll find a lot of allergies, people with the colds coming in. Dust, dander, animal dander, mold, and mildew. What is an anaphylactic reaction? It's a severe, potentially life-threatening, multi-organ system reaction which can affect anyone with food allergies and can only be stopped with epinephrine. Symptoms: hives, swelling, itching, shortness of breath or chest tightness, cramps, nausea, vomiting, diarrhea. You could have a drop in blood pressure or loss of consciousness. The biggest things that are being seen with a real bad allergic reaction are the hives and difficulty breathing. You can have swelling of the face, the lip, the tongue. That's what we most commonly see. These show how the symptoms from different organs or parts of the body it can affect. You have the mouth, you can have the itching, the swelling of the tongue, swelling of the throat, feel like you're closing of the throat. It can affect your lungs with the coughing and the wheezing, shortness of breath, just feel like you just can't suck in that air. On the skin, you get the redness, the swelling, the hives, the itching. Less commonly seen is the heart and the stomach, where you're having the weak pulse and dizziness. That's when you're seeing more of the real true anaphylactic and your body systems are shutting down. These are some photos of what an allergic reaction would look like. You can see the difference of the lip swelling, facial swelling, rashes and hives. A lot of times they feel like they just can't breathe. And what is an Epipen? It's a spring-loaded, ready-to-use, single-use of epinephrine. It is also called adrenaline. It's the drug of choice for emergency treatment. The Epipen is just a tool to administer the medication. You can use various different kind of tools. There are several out there, but like I said before, the Epipen is the most commonly used injector. Its action of the adrenaline can cause vasoconstriction, which constricts the blood vessels, but it improves the breathing by relaxing the smooth muscles. and it decreases the hives and the swelling because of the histamine that's released in the body that gets transported throughout the system. It helps decrease that. These are your different forms of EpiPens. The one on your left is the traditional, what we use and see mostly of the EpiPens. And there is another one on the right-hand side that's called Allerject. It does have a needle inside of it. It is a very long needle, and it is thick, and it will, like I said before, it will penetrate blue jeans, thick clothing. It's just, it has that kind of impact and force when used. That's what the EpiPen actually looks like. It also has descriptions on the side, if you had to use one, how to give it. You just pop the blue top, have it in your hand good firm, and you jab it literally into your thigh, and you hold it for 10 seconds. This one I am not familiar with it in using. I've not seen one, but they do give demonstrations on what they may look like and how they're used. We had a video, but it doesn't work. Regardless of whenever you have to give EpiPen, or if you see somebody that has received EpiPen, immediately call 911. Somebody needs to stay with that patient and until help gets there. And when know to use it. And I'm hoping through this presentation you know how to use it. And that is my favorite part of the slide. It has on the side steps 1, 2, and 3. Grab it in your most dominant hand, whichever hand, if you're left-handed or right-handed. Pull your blue top. It is ready to inject, and you just slam it into the side of your thigh and hold for 10 seconds. And it seemed like a long time. Oh yes, oh I'm so sorry.
Oh, I thought we were out. Thanks.
Sorry. And just to get it back to where it is reusable, just put the blue cap back on, squeeze the sides, and push it back until it clicks.
So you're just pulling off the blue and sewing it in your side. And these don't have a needle?
No, these are just trainers. These do not have needles in them. The company that makes the EpiPen was nice enough to send me several trainers.
So I don't even have to keep my finger on here?
No.
Okay. And they're refillable, is that what they are?
No.
Oh, okay.
Once you have used the EpiPen, it comes in an enclosed container. It will not fit completely into the container that it comes in. However, once an EpiPen is used, you need to take it to the hospital so they can properly dispose of the needle. And as soon as you have to use one, you need to get another prescription. If you're using it personally or whoever you know, they need to get another prescription from their doctor so they can get another EpiPen. But if you're working in a doctor's office, they should already have them in there. Yes?
So you must have a prescription, so you can't just go and buy one.
Right, you have to get a prescription. Any questions?